One of the dynamics in the Midwest, including Indiana, is the date of the first test of diagnosis for HIV and when they hit the AIDS definition or the AIDS diagnosis. And that's a shorter period of time, than on the coast. And part of the dynamic of that is that means people are not accessing early testing. They're, that they become infected, they don't know it, which means they're not taking care of themselves, they're not on medicines, they're unknowingly spreading it, and that it impacts the community, but it impacts them. So early testing is key, so that way there can be early diagnosis. The technology is changing, to the point there's been a home test. There's been a version of a home test for some time, but there's a version of a rapid home test, that's coming soon to a drugstore near you if it's not already there. And I think that's a good thing. I think the improvement in technology is helpful.
At our agency, typically last year we had 1 new positive. This year we've already had 7. Now we also have, in factoring that in, I got 2 new clients last week, and they were not tested by us. They were tested at a hospital. So technically, that would be 9 new cases this year instead of 1. Now, some of it is we're fishing in the right ponds. The prevention department is in the correct places where there's more risk. Hopefully there's more education. Hopefully there's more people who are less scared of getting a test. Hopefully the word is getting out that everyone should be tested.
This is a low incidence state. As you look, the numbers have been pretty steady according to the state health department. If you look at the numbers over the years, we're talking about new cases, not necessarily cases that move from state to state.